Non-communicable diseases, abbreviated as NCDs, are said to be the silent epidemic of our time. Every year, NCDs claim more than 41 million lives around the world. That's 3 out of every 4 deaths globally. In Kenya, NCDs are responsible for 41% of all deaths and over 50% of all hospital admissions. Unhealthy diets are a leading contributor, linked to 11 million deaths annually across the globe. 7 out of 10 people in low and middle income countries cannot afford a healthy diet. 1 out of 3 people face some form of malnutrition. People are now consuming more unhealthy foods, influenced by the physical, economic, political, and cultural food environments around them.
Lazima unajua ni kujipenda. Kama ujipendi ndio utaangalia. Unaweza kuwa unauziwa sumu.
Siangaliangi, naangalianga tu expiry date.
No, I don't. Naangalianga the size.
Naangalianga tu ni expiry date.
Siwezi angalia. Na pick mara ya kwanza, enda nakula. Kama tumbo itaniuma sirudi huko. Nabadilisha tena.
Okay, sometimes si rahisi kuangalia, maybe unaweza pata ni ile appetite tu niko nayo ya kukula crisps, but sometimes pia kuna vitu najua kama hii ni carbohydrates. For example, kama unga najua inanipea carbohydrates, meat najua inanipea protein.
No, I only look at the expiry date.
Yeah, I think one of the gaps in Kenya when it comes to labeling of foods, at the moment we have back of pack labeling on packaged foods. But these labels use fairly scientific names. They talk about proteins, carbohydrates, they talk about fats, unsaturated fats, complex fats, and so on. But the issue is how many people actually understand those terms. The other problem is they do give limits. They talk about maybe your daily requirements for these particular products or these particular ingredients. But how many people actually look, one, at the back of pack? And even if they look at the back of pack, do they understand what these ingredients are? Do you know what proteins are? Or do you know what carbohydrates are? So not only does it require one to have a certain level of knowledge, but also you'll find that this back of pack labeling is printed in small font. And this is a challenge to read, let alone to understand what they're talking about.
Maybe niseme sometimes we just assume, maybe pia sometimes watu hayuko awareness that wanafaa kuangalia hizo vitu.
Zimefichwa, hata watakangi mtu. Kwanza English ziko hapo, si English za mtu wa kawaida. Lazima wewe ulishikanisha chemistry, lakini ukishapata pale umeandikiwa potassium, sijui manganese, naona sasa ita ni masomo.
Itakuwa poa, ndio sasa itakuwa rahisi sasa si tuisome. Shida vile zinakuanga very tiny, like hadi mtu afikirika anaweza soma hadi hujui.
Waeke tu vitu zinaonekana, vitu kubwa kubwa, vitu zenye na wa interpret. Umeona? So mtu yeyote pia anaweza akajua kama mfano manganese ni ya kazi gani, ina help na nini. So tu kuweka hapo na haitoshi, iweke kubwa na bado tuweze kujua zina umuhimu gani.
Chansaidia juu nikibuy ndakuwa naona hapo hivyo imeandikwa kubwa kubwa, at least naweza realize kuna information hapo.
Hiyo communication wanatumia kwa hiyo factory ya mkate, wanafaa wa consider watu wenye get hizo terminologies.
Itatusaidia sana juu zingine tunachukua na tujui ziko aje.
So that is a gap, and that is why the front of pack labeling is required to present this information in a simplified way, just talking about, is this product high in these nutrients of concern? So that even as you look at the front of pack label, you can tell that yes, this food is probably high in one of the nutrients of concern. Then you can make an informed choice. limits as to whether or not you need to purchase it.
The knowledge gap is huge, is massive. Sadly, even amongst health advocates and healthcare providers, most people are only checking the product for expiry date, if at all, or for the price, and then comparing what is cheaper. And that's sadly what they'll go for. Also, when it comes to knowing what is it to check out for, sometimes a product maybe will have sugar, but they have given me the amount of sugar per serving. So let's say a product is 500 ml, and per serving, which is 100 ml, the amount of sugar is 20. So do we know how to read that? Do we know that by consuming the entire 500 ml, you will have 20 times 5? So you'll have 100 grams of that sugar in your body. Most of even the health advocates do not do that. So one of the things that we are really trying to do is to teach how to read food labels.
In Kenya, 40% of the population consumes unhealthy foods, with obesity rates surging. Recent national data shows a significant rise in overweight and obesity rates in Kenya, with women being especially affected. According to the Kenya Demographic and Health Survey, the rate among women significantly increased from 25% in 2008 to 49% in 2022. This is a clear reflection of a wider nutrition transition, a shift towards processed, high-fat, high-sugar, and high-salt diets. The numbers around diet-related non-communicable diseases are just as alarming. Obesity affects 45% of women of reproductive age and 20.9% of adult men. Diabetes now impacts 7.3% of adult women and 7.0% of adult men. Hypertension is also widespread, found in 27.4% of adult women and 26.9% of adult men. Worryingly, Kenya is currently off course in meeting the global 2030 targets for reducing diet-related NCDs. These trends underline the urgent need for stronger policy interventions and public awareness. The World Health Organization recommends limiting total fat to less than 30% of daily energy, saturated fat to under 10%, trans fats to under 2 grams per 100 grams, free sugars to less than 10%, and salt to less than 5 grams per day, and in turn, increasing fruits, legumes, whole grains, and nuts in daily diets. These figures reveal a clear need for policy-based solutions. Tools like front-of-pack nutrition labeling, restrictions on the marketing of unhealthy diets to children, fiscal policies, public procurement standards, and nutrient profile models, which serves as the foundation for all these interventions, help consumers make informed food choices. With clearly set thresholds, visible labels, people are empowered to choose healthier options, protecting lives and improving long-term health outcomes.
The nutrients of concern which have been identified are foods which are high in content of fats, high in salt, and also high in sugars. So these do tend to contribute as risk factors for conditions like heart conditions, for hypertension, also for diabetes, for certain cancers, and even contributing towards chronic respiratory diseases.
It is interesting that when you ask a lot of people if they know what front of package labeling means, it's like, well, is there a reason why the package should be, the labeling of the product should be at the front? Yes, there is. It is important because then every time we have the food labels, usually they are very, very small, somewhere stuck at the back of a product, barely legible, so people cannot even, it makes it difficult for you to read. But when we make it at the front of the package, it is a warning label. It is something that tells you this is how much this food contains, and so you're able to see it at first sight. So unfortunately, in the past, most manufacturers have labeled for us at the front what they want us to see. So they'll say no cholesterol. And that's what the person who is purchasing will see. But beneath, they have not specified for you, okay, fine, no cholesterol, what is the fat ingredient? What is the source of the fat that you're giving me from this food? It could be trans fats. So yes, you're saying there's no cholesterol, but trans fats are not healthy for the heart. Or you say no sugar added, but when you look at the component of the carbohydrate at the back of this, vis-a-vis the amount of fiber that is in this product, it is very little fiber, very high carbohydrate content. So yes, truthfully, maybe the person who's packaging it has not added extra sugars, but from the carbohydrates, the amounts could be in excess. So that front of package labeling serves as a warning. This is what this food contains, and if you consume it, this is this number of servings, this is what you're up for.
So one of the things which happens is if you're eating high energy dense foods and you're not physically active, the excess is going to be converted to fat. So that is where now the issues of overweight and obesity come into play. The other thing to remember with the unhealthy diets that are widespread in today's world, they're high in energy, but they have very low most of them are very low in micronutrients. And these micronutrients, like for example, the vitamins and the minerals, are ingredients which are required by the body in trace amounts. And these are specifically involved in various enzyme activities, which are critical for body function. So if you're eating energy-dense food, which are low in these micronutrients, it means that your biochemical systems are not going to be as efficient as they should be. And these are some of the things which are predisposing one to developing different types of non-communicable diseases. Specifically focusing on the area of unhealthy diets, Non-Communicable Disease Alliance of Kenya has been working with other partners and supporting the Ministry of Health in terms of developing regulatory policies to control, focus on promoting healthier food options. And in this regard, there are two specific areas that we've been working on. The nutrient profile model, as well as the restricted marketing of unhealthy foods and beverages to children, and also the front of pack labeling. So in order for us to be effective in the advocacy strategies, we have identified key players. This include the media, which is able now to reach, be it broadcast, print, even now the social media, and even online journalists, who is able to reach a much bigger audience than we can through just physical meetings or what NCD Alliance can do. So we've also worked with religious organizations. And in this, one of the projects, we're actually collaborating with NCCK, in addition to other religious organizations, because we recognize that it's important to reach people where they're at. Yes, we can have the media, but we also need to look at who else can we use to create awareness in the community. Religious organizations, religious leaders are well respected in our communities. And if we can work through these religious organizations, for example, through churches and other institutions, reaching people where they're at with these health messages. So in addition to the Ministry of Health, these are some of the other partners that we've been working with. And also, most importantly, working with persons with lived experience of non-communicable diseases, because they humanize, they present the human face of non-communicable diseases. We may say that yes, 41% of deaths and more than 55% of hospital admissions are due to non-communicable diseases. But it's important for us to remember that these are conditions affecting people. These people live with these conditions 365 days in a year, 24 hours in a day. And it's important for us to recognize them as the experts of their condition, and also to give them opportunity to share, what it is like to live with a non-communicable disease.
From the training, I got to connect how the food industry has corrupted our food system in terms of food market and the food environment in Kenya. The training brought out this intersection between these foods being in our market and then also contributing to the rise of non-communicable diseases in Kenya. And also finding out that there's a policy like front of package warning label that is being worked on, brought out now the facts and put out on the table that, okay, we're heading somewhere. We are working on this. We are fighting NCDs hand on, and through this initiative, we're able to reduce and also curb any adulteration or corruption of our food system anymore. Yes.
Me being part of this training, it has really helped me a lot because it has equipped me the knowledge, the right knowledge, so that I disseminate the right information to the public. And in terms of healthy eating, in terms of healthy foods, in terms of unhealthy foods, the right information that I got from this project has really helped me to disseminate the right information to the public. And I believe that I have helped so many people because I believe information is power if utilized correctly. And many people in my locality didn't know about the unhealthy foods that we eat that bring about NCDs. So me getting the knowledge from this training has really helped because I did not keep the knowledge to myself. I tried to present it in my shows, make sure that the people that listen to my show, they get the right information in terms of healthy eating, in terms of healthy living.
Sometimes when you go for the trainings, you are given data. Sometimes you go to the trainings, other people come into the trainings to help you understand that what you are communicating is not just something that is bracketed within your locality, but is international or is affecting lives globally. So I can say I'm having a lot of advantages to get this training because now I give first-hand information when I'm talking to my listeners anywhere.
I learned a lot, given that we set with the front of pack labeling. That labeling should be large enough to make someone like me be able to read. It's not like what we see. Other labels are large enough that to show the brand, but when it comes to the nutrient part of it, it's very, very small writings.
After the training, I noticed most processed food ziko na salt, fat na sugar, and whatever is available kwa market mostly ni processed food. Ukipiga kona unaona, ukienda huku unaona. And pia ilinifanya nikajua most people in Nairobi lunchtime wako able to access the processed food than the organic food. Yeah, so through the training I had myself kama diabetic person, I had the information now to be that keen on whatever I'm taking. Hata nikienda kwa supermarket, I take even some few minutes to understand the ingredients, whatever is on that drink before I purchase it.
The radio gives permission for call-ins. I have a whole recording of how they were asking the daktari questions about things they knew they were doing right when they were wrong. And they received very well this information. Some of them get it by totally shock because a mother calls in and says she has been going to hospital like every month, having a lot of problems with the things like with the pressure and what have you. But since listening to the program and changing her behavior just on diet and now taking the organic foods, then she's seeing a difference. So to me, we have quite a massive reaction that I can actually share.
After training, the first stop, first of all, was my family. To tell them that this is good and this is bad. And first of all, I just concentrated on two items. Three. One was the use of salt, which is not very, very good for someone to take much of it. There was another one, the uptake of sugar is not good for my health. The other thing was fats, eating fatty foods. So I made sure that I informed my family, my wife, and my children.
Me being a community champion, I come from Korogocho slums, and we planned a 1-week boot camp for the kids, this being the April holiday, where we teach the kids about drugs, about healthy living, and about the impacts of NCDs. And so we had the privilege to teach the kids about front of pack labeling, where we got the views from the kids, how they felt about going to the supermarket, buying food that are labeled, and that they have the knowledge that this type of food that I'm going to buy, it has high sugar, it has high salt, it has high fats. So I tried to get the views from the kids, how they felt being given that power to make the right healthy choices. And surprisingly, they were so happy because they felt like they had the power in their hands. Because right now we are going in the supermarkets, in the shops, in the kiosks, buying food that we don't know what it contains. Because I personally, as a health advocate, I don't understand what the ingredients at the back entail. But me being in this training, learning about the 3 ingredients of concern, the fats, the salt, and the sugar, I had the privilege to teach these young people that if this passes, you will have the privilege to go in the supermarket and make a healthy choice, because every product will have the warning label in front of it, the front of pack labeling. You will be able to know that this bread I'm going to buy, it is high in sugar. This bread that I'm going to buy, it is high in salt. This snack I'm going to buy, it is high in fats. So they were so happy because they'll make informed, healthy choices. Everybody wants to be healthy. Nobody wants NCDs.
My reporting is basically radio programs, and the people who can help us in getting this front of pack, they are the legislatures. So sometimes I do give interview space to members of local assembly, the county assembly, so that they can help us push the information on the legislative side. Then I've given 2 of them from Kakamega twice, and we have really talked about it because we are having a burden in our health sector, and the health sector is having this burden because of the food industry. So from their side, my purpose was just to go ask them to do, if they can make a law that can help us start understanding these issues. Number 2, we do have listeners who I can call fanatics. The person listens to what you tell him as a gospel truth and does not even want to argue with you. So at all time, when you give the information, he takes that information the way it is. He does not like cancelling or add on other information. So this information that we have been giving to the general public is the information that I've received from these trainings, and information that I think the public, when the masses have the information, they will also reciprocate to go and ask to check on the labels, to check on the foodstuffs, and many other products that they want to consume.
Niliona this is the best place I can visit na niwafundisha about what I've learned from the training. That's when nilichukua action kwenda kuongea na pastor nikamwambia, please, apart from teaching the young ones about the Bible, please can you cater for me 10 minutes ya kuongea about something that's happening outside and it's affecting even the church. Hapo ndo alinipatia chance, akanisikiza, and hapo ndo niliwaambia about unhealthy foods na nikawaprovia the one that we are giving children right now si poa. So nili notice for like hizi miaka zote zenye nimekuwa church, watoto walikuwa wanapatiwa juice and biscuit. And from information nilipata kutoka kwa training and being diabetic, niliona watoto wako na danger ya kupata NCDs because we have talked about the high sugar kwa juice, even the biscuits iko na high sugar sana. So niliona watoto watakuwa na risk ya kupata NCDs. As an advocate, as a person lived experience with diabetes, I had to take action so that I can save the children. So ndio nikaambia pastor, the same amount mnatumikia kupurchase hizi vitu, can we do fruits? Hapo ndio pastor alinisikiza, na children are doing apple na banana.
I decided to move out a bit and talk to my church member. My church, which is the Salvation Army. So I asked for that chance to talk to the congregation, and they took it positively, and I see most of them are trying to change, to know that sugar is not good, salt, fat. So that was a small in my small church. Then the preacher took it up and told him, you can't just give us this information and not others. So when they organize a church service of all the churches in Nairobi, the Salvation Army churches in Nairobi, I was given 20 minutes to talk to them. I realized that many of these people are suffering from high blood pressure, what have you. So they took it positively. So I thank NCD for organizing such training to myself.
The impact has been great because I could get messages from different experts, because my target audience is specifically policymakers and food experts. I could get messages of the experts mentioning how this initiative is critical, and others from outside Kenya asking how can we implement this in our own country. So it has been impactful, and through the feedback that I've received through my posts and also through one-on-one engagements and also through physical conferences, also summits and webinars, the feedback has been massive, and people are literally curious to see this policy being implemented.
All the people that I disseminated this information to, the 120 kids in my community, the 120 parents in my community, the 100 teachers in my community, they will not take that product that has the front of pack warning label, because they have the information that these 3 ingredients of concern bring about NCDs. And nobody wants to lead an unhealthy life. Everybody wants to be healthy.
I think in terms of the steps forward that we've made, yes, there is now, we have worked with the Ministry of Health and other partners to develop the nutrient profile model, and this is now ready for launching. It's actually been signed. I have copies now. And yes, so this is a big achievement because this is something which has been in the pipeline for many years. I remember I started working on this in, I think it was 2016-17. Obviously, there were some hindrances along the way, but now it's ready. It has been signed and it's actually available. In addition to this, also the front of pack labeling, nutrition labeling, and this is something which is going to really talk about the different levels of concern and for people to understand, as I mentioned, the different nutrients of concern are the fats, the refined sugars, and then the salt content. So essentially this is going to be a model or a way in which community members can look at packaged foods. They'll have different labels just to indicate whether they are high in salt, sugar, or fats, and then make a choice as to whether or not they would want to buy such products. Obviously, these are dependent on the nutrient profile model because this is the one which gives the limits of what the content should be acceptable for these packaged foods in terms of refined sugars, in terms of salt content, and also in terms of the fat content. So this is going to be a simple way for members of the public to identify nutrients, foods which are would provide healthier options because of the limited content of these nutrients of concern. Yeah. And also identify those foods, packaged foods, which are probably high in these nutrients of concern. And hopefully they can then make a choice to avoid those foods which are maybe very high in refined sugars, very high in salt content, and also very high in fat content.
This one is unique and it is close to what we desire. The way these front of package warning label will come into play. For example, we have case studies from Chile and how their rate of consumption of these foods dropped. So that is one impact that it have, that it will be so easy to read to any person interacting with these foods. As well, it will tame the food industry to avoid or reduce their involvement in corrupting our food environment. I believe also the importance of this is it will bring to perspective and also help address the rising cases of non-communicable diseases in Kenya.
You will eat by choice, just like a home. If you have a home that has a CCTV and dogs, and you label a home like this home is under surveillance, any other person who is coming there will know how to behave in that home. And like if you are hiding the security measures like the CCTV, then you see somebody in an awkward position. You see, this person can easily take you to court because you did not alarm the person that you are under surveillance. So it's important for us to have this information on the packets that the food you want to eat, it has these ingredients.
When you look at the policies which are currently in force, these don't actually address some of these issues. So in terms of the nutrients of concern, as you have mentioned, high contents of specifically refined sugars, saturated, high contents of fat and high contents of salt. These have been identified as risk factors for non-communicable diseases. Previously, these were not really factored into the regulations, so that has been a gap. And essentially, it is now known that we do need to have policies which will regulate the amount of salt in the food, the amount of sugars, and especially the processed and refined sugars.
True, when we copy something like what we have in South Africa, the traffic light system or the warning signs, then you're able to know. Even somebody who doesn't have much education is able to know red means stop, it is not good. So when it is color coded like that, then they're able to say, this one no. And then when they list them in terms of weight, this is the highest amount of this particular nutrient, and this is what it contains. Then you're able to make a decision and say, I have diabetes, for example. I need to regulate the amount of carbohydrates that I take. So if the fiber is just this much and the carbohydrate content is this much, then this is a product I may not what to consider buying. And if I buy it, then I have to stick to either the serving size that they've given or half or quarter the amount that they're recommending as a serving.
We also need to start looking at how much are we actually spending on treatment and care for non-communicable diseases vis-a-vis the money that the government is getting from the food industry as a result of taxes and other things. So is all the tax from these foods going into healthcare? And so essentially what I'm saying, we need to look at both sides of the coin, not just about the revenue streams, but also the health impact of these unhealthy foods on our population.
It is therefore the work of the policymaker to implement. We are a very good country in terms of creating policies. Most of even the East African countries, or actually just Africa in general, come for our policies, and they are very well written. We just don't implement them. So we need somebody to just say, let's start. Let's start. We will get that resistance in the beginning, but eventually it will pay off. We will be an example to the region, and everybody will be coming back to us and saying, this is good, let us do this.
Kenya is facing now a triple burden of malnutrition, something very devastating. We have not been able to curb undernutrition, that is the wasting and the stunting. It's still on the rise, it's still going further. Now we are here talking about overnutrition, talking about obesity. We can no longer continue keeping quiet. We cannot wait to have records or to sit down and look at these statistics as they rise, every other survey done. We need to ensure as policymakers, when these policies are brought on table, we should be quick enough to push them so that they may be implemented. Because this is safeguarding our health, safeguarding the future of the people in Kenya. Because if you allow the food industry, or rather the food corporations, to run our food environment, we have already seen what is happening in Western countries. It will happen also in Kenya and Africa. So we need robust actions towards policies that are positive, are bringing positive progress towards our food system and our health.
The policymaker, it will be useless for you to tell someone, don't take sugar or don't take too much of sugar. And then when you turn around, you find that you are the one who is taking that thing. So why can't they follow the talk?
I like it, but I'll ask media, even if tumefika up, let's spread this information until to the community level. People to know the importance of front pack labels.
We need to create awareness in the community about healthier food options, but not only just creating awareness, but making these choices available to everyone, available and accessible.
The public, when the masses have the information, they will also reciprocate to go and ask to check on the labels, to check on the foodstuffs and many other products that they want to consume. But two of it is just the legislation to help our MCAs understand that they're going for fundraisings to fundraise money for sick people because of what people eat.
So really we need to start looking at how can we change this this tsunami which is coming, because from where I sit, there's no way we're going to be able to manage non-communicable diseases if we do not prevent. It's going to be extremely expensive for the government to, even as we roll out, the different social health insurances and everything else. It's going to be extremely expensive as a cost center for the government. So let us focus on prevention. Let us focus on creating awareness about healthy food options. And let us focus on ensuring that everyone is able to access healthier foods for NCD prevention and control, and even just for their general